The Smart Brain Retractor, or SBR, is a device which augments the standard types of surgical retractors used during many intracranial surgeries. Its purpose is to assist neurosurgeons in the early detection and prevention of retraction-related trauma during routine neurological procedures by accurately controlling and minimizing the disturbance of brain tissue being operated upon. The Smart Brain Retractor allows physicians to directly monitor brain activity at the site of retraction and provides early warning as to the viability of the underlying tissue to prevent the occurrence of hypoxic ischemia. Intracranial operations, such as those involving vascular malformations, aneurysms, and certain tumors, require intraoperative retraction of the brain to obtain surgical access to deeper regions of interest where such lesions form. This brain retraction is needed to gain exposure, but pressure exerted on the sensitive brain tissue results in locally restricted blood flow, and eventually permanent tissue damage can occur. Brain retractors are malleable steel blades, typically attached to a flexible snake mounted on a stationary base, such as a Mayfield head holder. They are bent into any position required by the procedure to physically hold apart lobes of the brain, and can be detached and repositioned by the surgeon if needed. However, there is no feedback from the retractor to the surgeon whether a retracted region of the brain is injured or at risk of injury. The Smart Brain Retractor consists of an array of sensors mounted parallel on a pliable strip with an electronic microcontroller at the base, inserted into a disposable protective outer sheath. The sheath, with sensor strip, is fitted to a matching retractor blade. Particular variations of the basic design can accommodate the many common types of surgical brain retractors used today. Adjacent non-contact sensors on the strip measure the electrostatic field of brain tissue for electroencephalographic indications of local activity, as well as temperature, pressure, impedance, and blood flow. The microcontroller processes the data with a predictive algorithm to identify telltale signs of ischemia and anticipate the onset of damage, alerting the attending staff to a potential injury risk. The retractor blade is then simply repositioned to allow the subjected tissue to recover. An alert can automatically activate an auxiliary system, such as a drug infusion pump, to stabilize the patient. The Smart Brain Retractor offers predictive detection of trauma associated with surgical brain retraction and improves the quality of treatment for patients undergoing brain surgeries. A new approach to real-time biometrics from pharmacokinesis.